So I'm doing that occipital release one more time. Now you notice when I first push up, the head will feel a little bobbly, a little wobbly, okay? Well, with steering, you can balance the head on top of your fingertips, and it doesn't feel like at every second it's going to fall off. On the receiving side, you have to release the breath, and you want to try and collapse and let it go. The fact that the head doesn't just tilt back in this position tells me that my client here has actually already an injury or atrophy to the anterior paraspinals, because the anterior cervicals, because if they were completely healthy and completely responsive and completely functioning, they should be able to release, and she should be able just to relax and let her head pivot back at this point, but she can't. So she's got what Professor Thomas Hanna referred to as SMA, or sensory motor amnesia of the anterior cervical muscles. Right? Well, this is coaching, reminding those muscles high on the inside of the neck that they still have the ability to relax and let the neck have curvature. Okay, and basically what curvature am I giving her by doing this? The ability to look up. The ability to look up. We could talk probably for an hour on what are the postural ramifications of not being able to look up. And why can we not look up? Why do we lose by the time we're 30, 35, 30% average of our ability to look up? Okay, what is looking up about? Okay, I want you to think about that for a second. I'll give you just a little heads up, no pun intended, all right? But what do you usually do when you look up? You're looking at the sky, you're looking at the stars. When we look up, that is the opportunity that we have to get our eyes off of the horizon and off of the ground. When we're looking at our feet and we're looking at our ground, we're concerned with the immediacies of immediate survival and what's in our head and what's right in front of us, right that second, okay? When we're looking forward and at least have our eyes to a point where we can get square to the horizon, okay? Now we've got some prescience. In other words, we now have the ability to forecast the future a little bit, to look ahead a little bit, but maybe not so far, because it depends on our line of sight. In other words, all I know is what I can see. When I look up, I can see forever, right? And so as I grow up and I start to be stressed and my bubble of the universe starts to condense and fall in around me, I lose this real-time perception of the forever in my life. That I came from forever and I go to forever. And why have all the great saints and sages told us to look up? Okay? Look to the stars. Look to the sky. Why? What's the point? You know, what's the practical application of just getting my nozzle up into the air and looking at the stars and all this? Aside from, you know, validating the occasional UFO. Okay? Aside from that. But even that expands our universe, right? I look up in the sky and I see something I've never seen before, or something strange and wondrous. What does that do to me emotionally? It tells me emotionally that my world is a bigger place as of that moment than it was 1 second before, right? So when I look up, I can see forever. And the light I'm seeing, whatever that is coming from forever. When I look up, I can see the sun, which is the source of all life. When I look up, I can see the moon, which is our partner, our female partner that generates all of our cyclic biology. It's such a powerful force for us, all right? So yeah, being able to lose the ability to look up and being able to regain it is about expanding consciousness, okay? So now I'm moving up the back of the head. And what I'm doing as I'm moving up the back of the head is I'm just alternating my hands this way, keeping my fingertips strong. And that's why the nose will wobble as I move up. And again, I'm actually working both bladder lines as I'm coming up the back, because my hands are not exactly on the center line. Although we draw it as a picture. We show one line of points coming up the back of the head. But actually, if you look on, say, an acupuncture chart, or look on a nadi chart, Siddhartha and Pingala, they're not exactly on the center, are they? They're actually, there's a little gap, okay? Now once I get to as high as I can on the back, I change my hand position to this. So now I'm going to use a reinforced rolling thumb, and I'm going to work 5 points to the crown of the head. So I'm going to start on that last back point, and now I just rock to get pressure, because I'm not in a place where I can get mechanical pressure with my arms. All right, so I'm going to work all the way to the hairline. And when I get to the hairline, I'm going to split so that my thumbs are a thumb length apart, okay? And then I'm going to work 2 lines going back. And then when I get back to the center, I'm going to come back to center again, and I'm going to work back to the hairline. So basically, I'm going to do this little routine now 3 times. And back. And center. And I have to just relax and drop my shoulders and breathe. And when I come to that hairline for the 3rd time, I'm actually going to go back to the crown chakra point right here. And now I'm just going to lean into it, take a big breath, and I want to see the energy coming from my navel through my thumbs into the crown chakra point. And I'm almost kind of leaning on my thumbs. And I'm just going to hold this for a 10 count. 2, 3, 4, 5, 6, 7, 8, 9, 10. And now I'm going to come to the forehead, and I'm just going to do thumb circles, light thumb circles, out, back, out 3 times on the forehead, okay? And then after I do that, I'm going to do 12 lines. Line number 1, and I'm just going to lightly drag my thumbs with the pad of the thumb to the temple, and big thumb circles in front of the temple. They're a big marma in front, big loam in front of the ears here. So just make a big circle and you're on it. That's line number 1. Line number 2 is middle forehead and circle. Line number 3 is low forehead and circle. 1, 2, 3. Line number 4 is the eyebrow, and I do this on a little bit of an angle. I start on the corner and pull up into the eyebrow and eyebrow ridge, right? The ocular ridge here. And then I'm going to pull up and slide across the eyebrows, and I'm going to do this 3 times. So 4 is always 4, 4, 4. We do 4 3 times. Now there are lots of other points that I can work on the face, but we're not really doing the acupressure facial right now. I'm doing a general acupressure facial. So I'm not working all the 35 points individually. All right. Now from there, I'm going to change my hand position, and I'm going to work starting what we call the nose lines. There are 3. Line number 1, top of the nose, light finger pressure under the eye and out to in front of the ears, and then finger circles in front of the ears. That's 5. 6, middle of the nose, down to the base of the nose, across the front of the cheekbone, and continue to the ear and circle. 7, end of the nose to the outside of the nostrils. Don't put your fingers in the nostrils, outside the nostrils. Press those points and then loop under the cheekbone to in front of the ears and circle. 8 is called the center point or maxilla point, because that's the name of the bone. That's the upper part of the mouth. I'm going to work the center point with 1 finger, and then I'm going to drag out with both fingers across the middle of the cheek and circle up in front of the ears and circle. All right, 9 we call the happy points or clown points, because I go out clearly outside the corners of the mouth, because I'm not going to put my fingers in her mouth, and I'm going to push straight down and up. And you see the little smile? Okay, that tells you you're in the right place. Just for a second, and then I'm going to draw back out in front of the ears and circle. Okay, 10 is the bottom center point below the mouth. Press with 1 thumb. Okay, because it's 1 point, but then I'm going to use both thumbs to come across the front of the jawbone top of the jawbone, up in front of the ear and circle. 11 is called front of the ramus, or if the jawbone is the ramus, okay? I'm right on the top front edge, thumbs together like this, and I'm gonna pinch a little bit down, and then I'm gonna draw out, staying on that front edge. You can even see a little line, I think. And then up in front of the ears. And 12 is I take my index fingers and hook up under the front of the chin to the first soft place, and with light finger pressure, follow underneath the edge of the jaw, all the way under and around the corner of the ramus, jawbone, up in front of the ear, and then finger circles there. Okay, and I just do these lines one time, not too hard, don't burn or tear or scratch, okay? And then come to the ear, starting at the bottom, okay? I'm gonna scrunch. This is that same technique we used on the fingers to release the adhesions or skin. We say twist the fingers. So this is called twist the ears, but more correctly, it's sliding like this, sliding like this. So I'm scrunching, which is, you know, one of my former clients who was a Jewish lady, she said, I mushed and I scrunched. And so it seemed to fit, so I'm going with it, you know. But I'm also gonna pull down a little bit on the ear while I do this. So technically, I guess in massage terms, you'd call this a kind of cross fiber and friction against the tissue. So I'm going bottom to top, 1, and start again. Watch out for earrings, pierced earrings, that kind of thing. 2, so you don't want to pull them out. All right, 3, okay. And then I'm going to grab right in the center of the ear, and I'm just going to push down and hold this for 10 seconds while pinching both sides of the ear with what we call C-clamp compression. So I'm just hooked inside the edge of the ear, back and front, and what I'm going to do is lightly, it's not a hard pinch, just press down, hold for 10 count. Then I'm going to warm up my hands, take a big breath, and as I exhale, I'm going to cup the ears and I'm going to get my elbows out and press. And now what I'm going to do is I'm going to visualize the breath circulating in my heart channel, microcosmic orbit, from my heart through my hands. Remember, 4th chakra, the organs of expression, and the work organs of 4th chakra are the arms and hands. And that's also what we call the microcosmic orbit. So I'm actually now, her crown is in my conception vessel point, which is a primary point on the macrocosmic orbit, and I've got a circuit of microcosmic orbit going through my heart, and I just visualize my breath for a minute, about 10 count, flowing these 2 circuits, top and bottom, connecting heaven and earth, inner and outer, and relating it to the practical expression of love, which is what I'm doing. My hands are expressing the love in my heart. And so I just have a warm breath and see the light between my hands for about a 10 count. And then when I finish, okay, what I'm gonna do is just slip back and nice and easy, just rock back until I can gently set the head on the floor.